Our next speaker is Dr. Laura Bulk, who will be speaking on representation, diversity, and cultural safety in the health professions. Health equity requires access and quality, and Dr. Bulk will share about increasing both access and quality via cultural safety. Dr. Bulk is an assistant professor of teaching in the Department of Occupational Science and Occupational Therapy at UBC. She's also a daughter, disabled scholar, advocate, friend, learner, woman, teacher, mentor, sister, tanta, mentee, occupational therapist, artist, PSI scholar, and activist. So it contains multitudes. Please welcome Dr. Laura Bulk.
All right. Is this working? You can hear me? Yeah? Okay. I am going to start with a story about a baby, because who doesn't like baby photos? I mean, that's just fun. So this little girl was born at a hefty 10 pounds, 6 ounces, and 23 inches into a family of immigrants, farmers, and self-employed parents with many, many cousins and aunts and uncles and an older sister. Shortly after this little girl was born, her parents would be investigated by the ministry for abuse, for what was soon to be found out to be symptoms related to a rare neurological condition. Health equity. That has to do with accessing health, being able to obtain our highest potential of health in the absence of barriers related to things like social status and social positions. I can stand over here, this is better.
There you go.
You lied, you couldn't hear me. Do you want me to start again? We're good? Okay, we're good, I hear you. I hope you're not lying this time. All right. So she and her family, they would experience a range of advantages and disadvantages in the healthcare system. They would travel for healthcare not knowing that the government actually covers that. They would access numerous healthcare professionals, all of whom would see them as a very interesting anomaly. They would not know what they don't know and not know what questions they should be asking. They would also meet various healthcare providers who would make an incredible positive impact in their lives. One of those providers, a geneticist, would ask this little girl with a twinkle in her eye, "What do you want to be when you grow up?" And she would say, "You could be a doctor just like me." The little girl would peer up at her very sparkly earrings, listen to her polished way of speaking, hear the clicking of her fancy shoes, and wonder, can I? And, well, can she? Neither of her parents nor anyone in her family has obtained higher education. Only one of her parents had the opportunity to go to high school. And they provide incredible emotional, psychological, and spiritual support, but would have no means of providing financial or informational support. They support her and know that her disability, her health condition, where she comes from, really won't limit her in what she can become, but she will face barriers. That, that geneticist's comment might have planted a seed. And I hope that maybe she will become a physician or maybe an occupational therapist. Because I've learned through research, through personal experience, through community-based research, that having providers who have diverse experiences is really important. It increases health equity. We've heard from patients and providers and community members that healthcare really requires diversity of perspectives and of experiences. Some of you may have heard of culturally safer care. And we know that culturally safer care, one of the pillars is representation. And so I would argue that health equity requires representation, because to achieve health equity, people need to be willing to access healthcare. As we've heard today, that can be a major barrier for some communities. Just accessing healthcare can come with trauma and can come with challenges. So we know that having healthcare providers who perhaps reflect some of your own experiences and perspectives increases the chances that you too will access healthcare. And we've heard that people feel safer when their healthcare provider shares some aspects of their lived experiences. And we also know that people from equity-denied groups are still underrepresented in our healthcare. But we're doing some things to hopefully start to shift that. One of those is called DeHope. And the Diversifying Health Professions Education Program is an initiative started a few years ago, and it is to reach out to youth from equity-denied groups to introduce them to healthcare professions and health professions education through a summer program and through mentorship. Some of what we've heard from people who've participated in this program. I learned about what my future could look like and the paths I can take to get there, and that I am good enough to get there. I have downplayed or tried to hide part of my identity before, and it is nice to see that I can bring my lived experiences to whatever profession I might pursue. And I learned that I didn't need to change in order to fit in healthcare, that I could bring my own passions and experiences to it. And I think that's really valuable. I'm going to further argue that health equity requires belonging. We know that to fit in, you need to assess the situation and figure out how you need to change in order to be accepted. But belonging requires us to be who we are. And as we learned from that participant and many others, we need to create healthcare spaces where, as healthcare providers, we know that our experiential expertise matters. We've even noticed that today in some of our speakers who bring experiential expertise to the work that they're doing. And their work is better because of that expertise. So I suggest that advancing health equity involves advancing the possibilities for people with experiential expertise to bring that into our healthcare system as providers. Oh, and that little girl, she did become an occupational therapist, and she became a doctor, but not the kind who can diagnose you with anything. And I want to thank the Inclusive Campus Project, the DeHope team, my department, and of course the PSI for all the support that I've got to be part of this important work. And thank you all for being here and for coming to the brainstorming session after to think together with us about how we can, as a community, advance health equity.